And joining us now is Dr. Alan Leifeste, joining us from Southeast Texas Medical Associates. I said that right?
You said it correctly.
Perfect. Okay, we are actually pleased to have you here with us. This is your first time on the show. Thank you for being here. We're talking today, could you tell us, Dr. Alan, what is the worst thing that a person with diabetes does as far as the habits?
Now, Jessica, there are 3 bad habits people with diabetes can really get into. One of them is they gain weight. 2 is they stop exercising or decide not to exercise. And one of the worst is actually they can smoke. And smoking is what we really want to focus on today because smoking and diabetes together have a tremendously increased risk of cardiovascular disease.
Oh, wow. Okay, so SETMA, do they do things to address smoking? I mean, like it's a bad habit, but it is a habit for some people and it's hard.
It's absolutely. It's one of the things they really need to focus on stopping. We actually did an audit on our patient records, and we have about 8,000 patients at SETMA that have diabetes.
Okay.
Now, out of those 8,000 patients, 724 of them have actually smoked. And we went back and looked at our records, and 93 patients out of the 724 have undocumented, well, we go through an audit of the charts and look for patients who've had documentation that we've gone through and taught them about smoking cessation, either through our LESS initiative, through medications that we give for smoking cessation, or for or by a documented physician recommendation to stop smoking.
And is that what you are doing to address the issue in each individual patient that may be having that problem? Yeah,
actually, there's several things that we're doing, okay? Out of that 724 patients that we've documented that are still smoking with diabetes, we've sent phone calls to each one of them. We've sent a letter to each one of them, and we're also scheduling an appointment for each one of them so we can bring them in and educate them more about the patient dangers of smoking while they have diabetes.
Now, is the smoking, you know, it endangers their heart? Is that with blockage, or can it be anything?
Absolutely. Any vessel in the body. Smoking kind of amplifies the calcification of the arteries, and when you have diabetes and you combine smoking with it, it's astronomically increasing the risk of cardiovascular disease, stroke, heart attack, vascular disease of the legs.
And when you mentioned the gaining of the weight, and of course we're you know, talking about the risk of smoking, but a lot of times it may be harder for people with diabetes. I'm not sure if they can do different exercises like you said, and then it gets harder for them when they gain weight. Absolutely.
Well, we discussed what we call the LESS initiative at SETMA, which is lose weight, exercise, and stop smoking. Now, exercises can be different for different individuals. If I were a marathon runner, you know, my exercise would be running a marathon. But if I weighed 400 or 500 pounds, which some of our patients do with diabetes, my exercise might be just getting up and moving around and walking. But it's a start. We need to get patients up and walking, get them to stop smoking, and to start losing weight.
And like you mentioned, the moving around, even if it is just walking, people may not really realize how much of a difference that can, how beneficial that can be just walking around.
Absolutely. My goal is to have my patients up and moving 35 minutes straight every day.
Oh, wow.
Now, I'd like them to be walking at least 2 miles a day, but I'll take 35 minutes when I can get it.
And if anybody has any questions, maybe they are a patient or not a patient yet, but they do have diabetes or something like that, can they just contact any of the physicians at SETMA?
Absolutely. We strive at SETMA to kind of control diabetes, and we are a Joslin Diabetes Center, and our goal is to control diabetes in Southeast Texas.
And awareness may be a lot of it too.
Absolutely.
People don't realize.
The more education we can give patients, the better decisions they can make regarding their health.
Great. Sounds great. We appreciate you joining us today. Nice to meet you, and thank you for having me on the show. And we'll have to check back in with the results too. Hopefully that all works out well for the patient.